AI is incredible. It can teach you how to fry an egg and even write a poem, pirate style. Yarr! But it knows nothing about your work. Slackbot is different. It doesn't just know the facts. It knows your schedule. It can turn a brainstorm into a brief. And it doesn't need to be taught. Because Slackbot isn't just another AI. It's AI that knows your work as well as you do. Visit slack.com/meet Slackbot to learn more.
I already love same-day delivery with Shipt, but it's so much better since I signed up for Target's Circle 360. Why? Because I no longer pay price markups from the majority of stores through Shipt. Only a handful of alcohol retailers and items don't count. That means no markups on groceries, pet food, even home goods and makeup. So to recap, I have more time to catch up on life while someone shops for me, and I spend less. It's a win-win. Order now at shipt.com/360. Terms apply.
Hi, my name's Alex Conway, and I'm a third-year medical student at Kaiser School of Medicine. Cardiovascular 10. A 31-year-old woman presents to the emergency department for feeling weak and fatigued for 1 week. The patient has a past medical history of end-stage renal disease, ESRD, with anuria and systemic lupus erythematosus. She reports that she has missed hemodialysis for 10 days due to feeling fatigue. While in the emergency department, the patient has seizure-like activity and no pulse is palpable. Chest compressions are started, and eventually return of spontaneous circulation is achieved. Which of the following is the most likely cause of this patient's cardiac arrest? A. Hypercalcemia. B. Hyperkalemia. C. Hyperphosphatemia. D. Hypokalemia. Or E. Hypomagnesemia. The correct answer is B. Hyperkalemia. The patient has not had hemodialysis for a prolonged period of time. In patients with ESRD with anuria, electrolyte imbalances occur due to lack of excretion in the urine. Electrolytes that remain elevated are potassium, phosphate, and magnesium. Hyperkalemia can cause ECG changes such as peaked T waves, which, when left untreated, can turn into a sinusoidal pattern because of decreased P wave height, a widened QRS, and PR prolongation. This causes an arrhythmia and may lead to cardiac arrest. Answer choice A, hypercalcemia, is incorrect. ESRD leads to hypocalcemia, not hypercalcemia. Answer choice C, hyperphosphatemia, is incorrect. Long-standing elevated phosphate can cause left ventricular hypertrophy, but is less likely to be the main cause of arrhythmia in this patient. Answer choice D, hypokalemia, is incorrect. ESRD leads to hyperkalemia, not hypokalemia. Answer choice E, hypomagnesemia, is incorrect. ESRD results in hypermagnesemia, not hypomagnesemia. Key learning points. Patients with ESRD are prone to hyperkalemia, which can lead to significant ECG changes and cardiac arrhythmia. Cardiovascular question 11. A 45-year-old man presents to the emergency department for evaluation of a fluttering heart, dizziness, and shortness of breath, which have been constant since yesterday evening. Past medical history is significant for atrial fibrillation and hypertension. Of note, the patient typically takes daily metoprolol, but he was unable to afford his most recent prescription refill. Physical examination is significant for a blood pressure of 90/50 millimeters of mercury, heart rate of 122 beats per minute, and an irregularly irregular heartbeat. A normal jugular venous pressure tracing, JVP tracing, is available online. Which of the following changes to the jugular venous pressure JVP tracing is most expected in this patient? A. Attenuated A wave and X descent. B. Attenuated X descent with prominent V wave. C. Attenuated Y descent only. D. Prominent A wave only. Or E. Prominent A wave with attenuated Y descent. The correct answer is A. attenuated A wave and X descent. This patient is likely an atrial fibrillation, which attenuates atrial systole and atrial kick, represented by the A wave. Because the right atrium fails to fully empty into the right ventricle, the X descent that typically results from ventricular systole, relieving pressure on the right atrium, cannot occur. Answer choice B, attenuated X descent with prominent V wave, is incorrect. This JVP waveform occurs with tricuspid regurgitation. The V wave, which occurs towards the end of ventricular systole and maximal atrial filling, is prominent due to backflow of blood into the right atrium through the tricuspid valve. Answer choice C, attenuated Y descent only, is incorrect. This JVP waveform occurs with cardiac tamponade, which impairs ventricular diastolic filling. Answer choice D, prominent A wave only, is incorrect. This JVP waveform occurs with atrioventricular, AV, dissociation, and is also known as a Cannon A wave. It occurs due to contraction of the right atrium against a closed tricuspid valve. Answer choice E, prominent A wave with attenuated Y descent, is incorrect. This JVP waveform occurs with tricuspid stenosis. The stenotic valve attenuates flow of blood from the right atrium to right ventricle during ventricular diastole. Key learning point. Jugular venous pressure tracings reflect cardiovascular pathology and are composed of 5 main components: an A wave representing atrial contraction, a C wave representing the beginning of ventricular systole and the bulging and closure of the tricuspid valve back into the right atrium. The X descent in the JVP is due to atrial relaxation following the summit of the A wave formed by atrial contraction during sinus rhythm. The X descent occurs during ventricular systole with rising RV pressure. The V wave represents maximal atrial filling, and a Y descent represents the beginning of ventricular diastole.
I had that dream again. My small business needs to hire, but I don't use LinkedIn, and I hire an energy vampire. But also they're a literal vampire. And suddenly my team is spending all their time sharpening wooden stakes and buying bulk silver and rehearsing ancient chants, and then I wake up.
Don't let hiring nightmares ruin your dreams. LinkedIn Jobs' new AI assistant takes insights from over 1 billion professionals to create a short list of the best fits for you. Post your job for free at linkedin.com/quality. Start hiring today with LinkedIn.
Año nuevo, los mismos Extra Value Meals en McDonald's. Ahora te puedes llevar 2 snack wraps y papitas y una bebida mediana por solo $8. Solo por tiempo limitado. Precios y participación pueden variar. Los precios pueden ser más altos en Hawaii, Alaska y California y con entrega.
Cardiovascular question 12. A 63-year-old man presents to his primary care physician for evaluation of fatigue, shortness of breath while walking, and swelling in his legs, which have gotten worse over the last several months. Past medical history is significant for radiation therapy to the base of his neck 10 years ago for squamous cell carcinoma. Physical examination reveals peripheral edema in the legs, hepatomegaly, and mild ascites. Chest radiograph reveals pericardial calcifications. Which of the following additional features is most likely present in this patient? A. Audible S3 heart sound. B. Biventricular enlargement. C. Kussmaul sign. D. Pericardial knock in early systole. Or E. Proteinuria. The correct answer is C. Kussmaul sign. This patient has constrictive pericarditis, a condition in which granulation tissue formation in the pericardium results in loss of pericardial elasticity, which impairs venous return to the right side of the heart. Pericardial calcifications, seen on this patient's chest X-ray, are usually seen in patients with a history of pericarditis and may be associated with constrictive pericarditis. Signs and symptoms of constrictive pericarditis include dyspnea, fatigue, peripheral edema, and ascites. Kussmaul sign is the paradoxical increase in jugular venous pressure on inspiration due to impaired filling and backup into the venous system. Answer choice A, audible S3 heart sound, is incorrect. This typically reflects fluid overload and enlarged ventricular chambers. It is more frequently associated with patients who have dilated cardiomyopathy and/or severe mitral regurgitation, though it can also be present in athletes and during pregnancy. An S3 heart sound is typically low-pitched, while a pericardial knock is typically high-pitched. Answer choice B, biventricular enlargement, is incorrect. Constrictive pericarditis is more likely to cause biatrial enlargement. Answer choice D, pericardial knock in early systole, is incorrect. Although a pericardial knock can be heard in constrictive pericarditis, it is an early diastolic sound. Answer choice E, proteinuria, is incorrect. Although proteinuria leading to hypoalbuminemia can cause peripheral edema and ascites, this patient's history of radiation therapy and chest X-ray findings make constrictive pericarditis a more likely cause of his symptoms. Key learning point. Constrictive pericarditis may present with the Kussmaul sign, a paradoxical rise in jugular venous pressure during inspiration due to impaired filling of the right side of the heart.
Hey everyone, Chris here from MedPrep to Go, and I wanted to tell you about our MedPrep to Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com. Hey everyone, Chris here from MedPrep to Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com.